My dear viewers, we have Dr. SriDevi, obstetrician gynecologist. She is going to educate what are the causes of anemia. Over to Dr. SriDevi.
Thank you. So about the causes, as we already said, the hemoglobin is reduced and that is present in the RPC, the red blood cell. So either the production of the RPCs can be reduced or there can be loss. It can move away or it can be destroyed at an earlier stage. These are the causes of anemia. Now coming on to the causes where there is the demand is more, it is in iron deficiency anemia. So where in pregnancy what happens is the demand increases. So in pregnancy who are at a high risk, that is when they have a teenage pregnancy, that's pregnancy very early, or when the number of pregnancies are increased, like for example the third or the fourth pregnancy, and the spacing between the pregnancies is reduced. Like in 1 year itself they conceive without even the stores coming back to normal. So this is with pregnancy, and also when in multiple pregnancy, that's in twins where their demand increases. The next where there is loss. The loss mainly in menstruation, that is monthly when they get their periods, like when the amount of bleeding is more or the number of days they have more bleeding, or they get in between, like the duration, in between 10 days, 15 days itself they get their periods. So that kind of thing where the loss is more. And also there are other chronic loss, that is you don't feel it as an acute blood loss but chronic. So those conditions are like hookworm infestation, where there will be a minimal loss of blood every day, and also where they might have some bleeding from the rectum, we call that as melena, or other chronic diseases like malaria and kidney diseases. And when also they take some drugs that can cause, the bone marrow only produces these RPCs, so that can cause damage to the bone marrow. And or drugs like aspirin, when they take for a prolonged period of time, what happens is they get some ulcer and that erodes. So chronically there will be minimal blood loss, which in fact will lead to a major loss later. So these are the main causes of anemia.
Yeah, and as you rightly said, subsequent pregnancies in a shorter time. That also, and prolonged lactation. And also the blood loss more during delivery due to antepartum hemorrhage or postpartum hemorrhage or cesarean or any event when the woman loses a lot of blood. That can happen during delivery. That is another important, maybe traumatic postpartum hemorrhage. Continuous chronic anemia, I think maybe malaria, that all you are enumerated. These are the causes, common causes of anemia. Okay? Okay, thank you, doctor. Thank you.